Hello and welcome to the Linden Oaks Parent Series. I'm Kelly Fisher from Linden Oaks Marketing. Today's webinar is Hard to Swallow, Medication Safety and the Importance of Adhering. If you at any questions if you at any point have questions, feel free to chat me directly or email lindenoaksmarketing@eehealth.org. After the presentation today, we will ask you to fill out a short evaluation on our speaker. The evaluation will open in the polling section on the right-hand side of your screen. As a reminder, the poll is open for 5 minutes. Upon the 5 minutes, the poll will automatically close. If you're interested in attending our last Parent Education Series webinar of the year, it is August 16th, and the topic is Goodbye Summer, Hello Anxiety. Helpful strategies to transition your teen back to school. Linden Oaks treats ages 8 and up now. We are not happy to announce our child anxiety program. In addition, we also treat depression, addiction, substance misuse, eating disorders, PTSD, trauma, and other mental health concerns. We're a full continuum of care, including inpatient, hospital-based day programs, outpatient therapy, and medication management. We're networked with most major insurance companies, and here's the full list attached. Linden Oaks has services available at multiple locations: Naperville outpatient, Naperville inpatient, Mokina outpatient, Plainfield outpatient, Hinsdale outpatient, St. Charles outpatient, and Woodridge outpatient for eating disorder specifically. If you or someone you know is feeling anxious or depressed, the mental health conditions are highly treatable, but many do not seek treatment. So this can lead to serious issues with school, family, substance use, and even thoughts of harm. For support, you can use the QR code below or call our 24/7 hotline 630-305-5027. If you're looking for more information, you are also welcome to take our 5-minute AWARE test to gauge your mental health. It covers anxiety, depression, and addiction awareness. And you can complete that by using the QR code as well. I'm happy to introduce Sam Epley to cover Hard to Swallow, medication safety, and the importance of adhering. Sam, go ahead and you can take over.
Wonderful. Well, thank you so much, Kelly. Thank you for the introduction. My name is Sam Epley. I am a nurse here at Linden Oaks, and I work in our outpatient programming. And I've worked as well as in our inpatient programming as well. So I'm excited to share some of my experience with you about medications from the perspective of a nurse. So we're going to be talking about safety and the importance of adhering to medications tonight. So we are going to go. Our goals for this evening are we're going to identify medication safety practices. We're going to recognize common reasons why people do not adhere to medications. Fancy way of saying not taking their medication. Strategies to promote folks taking their medications, and also identifying community resources regarding medication safety. I'd like to start with some intent. Kind of more of the why behind talking about medication safety and adherence. I want folks to be informed consumers. This is your healthcare. This is your teenager's healthcare. I want you all to be able to be informed about the decisions that you're making about your health. I think it's also really important that we know the why behind medications. I think there's some myths and misconceptions about that. We're going to kind of get into some of the whys. I see medication as a tool. It isn't the only mental health treatment out there. It is one part of the overall treatment, especially here at Linden Oaks. We have as Kelly said in the introduction, we have multiple varieties of treatment here, and medication is a big part of that. And I think most importantly, as a nurse, the number one priority for us taking care of our patients is safety. I don't believe medication is a joke, so we're going to be going over some safety guidelines around medications. Right, before we get into the content, I just wanted to introduce myself. I am a nurse of 5 years. I went to Rush University College of Nursing to get my master's degree. I am a clinical nurse leader currently in my profession, as well as studied that formally at Rush University. My first job out of nursing school was a labor and delivery nurse. It was a wonderful experience seeing new life being brought into the world and working with the itty bitties. And I've always had a passion for mental health, and uh, took a little bit of a detour to get to mental health care, but I am currently a psychiatric nurse or behavioral health nurse, or what I like to call being a mental health nurse, because I truly believe everyone's mental health is one of the most important things, and something in medicine that we're at the forefront of really understanding how important people's mental well-being is for overall health. A few other fun facts about me. You'd often find me cooking fresh vegetables from a local farm. It's one of my favorite pastimes. I love reading sci-fi and walking along the Fox River. All right, we will get started with our content tonight. So safety is where we're going to start first. So kind of putting this into context, medications are one of the leading uh, causes of overdose. So I'm going to bring some numbers in here. So what's important to know is that these numbers don't differentiate between unintentional, which would be accidental overdose, or intentional overdose, which would be maybe associated with suicidality and suicidal thoughts and acting on those. So what we see in the data from the Poison Control Center and studying population health is that 14 to 18-year-olds, the number of deaths associated with overdose in 2010, so about 13 years ago, was approximately 518 deaths. We saw that number stay about the same from 2011 to 2019 at 492 deaths on average throughout that time period. We saw a massive uptick in that just a year later, the beginning of the pandemic, 2020. We saw a doubling of those numbers, 954 deaths associated with overdose. And those numbers seem to increase as well in 2021, 1,146 deaths associated with overdose. And I'll give some more numbers related to medications. So some striking numbers there. So one of our resources we have in this country is the Poison Control Center, and they track data of the number of calls that come in asking for medical advice and guidance on how to treat various things, whether it's household cleaners to medications to plants and pesticides. So in 2021 specifically, there were over 2 million calls to the Poison Control Center. About 9% of, and I should preface this, that the data from the Poison Control Center is not super clear on how we are to interpret it. So these numbers may not be reflective of that total 2 million calls, but around 6%, about 9% of those calls related to overdose were teenagers, which factors out to be 1,870 calls in 2021. The estimate here is 66.7% of those calls were related to suicide attempts by teenagers. And well, yeah, in about maybe 55 to 66%. We can further look at that data in the tens of thousands related to pain medications, supplements, herbal medications, vitamins, antihistamines, and topical preparations. So there's a significant number of overdoses in this country. And that's why I want to talk about it with you all tonight, is that this represents a significant number of human beings and things that I think could be prevented in many different ways with some safety precautions to be taken. We may not be able to prevent all of these, but some of the tools and strategies I'm going to talk about tonight will be related to safety and mitigating this risk. So the first thing I talk about with safety, this is one of the first things they taught us in nursing school, is know your rights. So there's 5 of them. There's the right person, the right medication, the right time, the right dose, and the right route. So I'll go over each of these. So person is the medication's prescribed to that person. The person that's prescribed that medication should be the only person taking that medication. Or in the case of like an uh, supplement or an over-the-counter medication, that should be recommended for that person to be taking. So the right person, the right medication. Got to double check to make sure that the name of the medication is the one that we're prescribed. Doctors will and prescribers will tell patients to take medications at different times. So we want to make sure we're taking that at the right time. Some medications need to be taken in the morning, some at night, and never the opposite. Got to make sure it's the right dose, the right amount. Every medication has a dose and the right route. This one's really important. Do you take it as a pill? Is it a nasal spray? Is it an ear drop? I don't want to eat an eardrop, so we want to make sure that we're giving it in the right route. So I know phone and callers may not be able to see this picture that I have, but every medication that is prescribed by medication provider and given at a pharmacy has a label. So every piece of those 5 rights is on this label. So the name of the patient, the medication, the dose, how to take it, when to take it, and making sure it's the right dose. So pay very close attention to those medication labels on pill bottles. Those are really important pieces of information. And we're human, we make mistakes. So it's always good to double check and not just assume that the pharmacist or the pharmacy dispensed it correctly. So 5 rights: medication, dose, time, route, and person. So further, that how to take it piece, there's some things to consider. Is it to be taken with food? Some mental health medications actually have a certain calorie count that is required for that medication to be best absorbed. How do we measure it? I know, especially for some of our younger teenagers in early adolescence, swallowing medications can be difficult. So we can have liquid formulations of mental health medications. So on the screen here, there's uh, oral syringes, medicine droppers, dosing spoons, dosing cups. So the things we often maybe associate with early childhood, we can still use those for our adolescent patients. I know not necessarily specific to mental health medications, but is there any special equipment that's required? So the example that comes to mind is asthma medication. Is there a spacer? Is there a machine to deliver that medication? So we just want to make sure we're asking these questions. How do I take these medications? And if I'm not sure, who can I ask? I can always ask the medication provider, it's the doctor, the nurse practitioner. I can always ask the pharmacist or the pharmacist tech. Uh, and even us nurses, we know how to work these medications as well. So that's how to take it. Some fun considerations. One of my favorites questions that I often get asked is, "What? I've heard this thing about grapefruit juice. What is this with grapefruit juice?" And the rule of thumb is there's a lot of medications that interact with grapefruit juice, and there's a lot of science behind it, a lot of physics behind it. The short and sweet of it is that grapefruit juice prevents the liver from metabolizing medications correctly, some medications. So what ends up happening is that the body might build up more medication in the bloodstream, and the liver being the part of the body that helps clean out the blood. And when a medication is done doing what it's supposed to do, the liver packages it up and gets it out of the body. So grapefruit juice for some medications can really prevent that from happening. So if a doctor ever says, "Hey, don't take this medication with grapefruit juice," that's why. I put a caveat here too, as well as over-the-counter medications. Those are medications. Some of them were actually prescriptions at one time, so those aren't to be messed around with as well. That the best kind of practice is to ask a doctor, uh, are there any interactions with this medication, with the current medications I'm taking? Is it safe for me to take? Uh, Adolescents can have different doses of those compared to adults, so there's things to consider. I also consider supplements like over-the-counter herbals, vitamins to be equally as important in this conversation, and really to be discussed with a medical professional about what they're used for, how best to be used. The reality is the supplement market is largely unregulated, and namely the FDA has not really had a chance to vet the if it's safe or not. Doesn't discredit that some providers and medication providers actually do say, hey, take the supplement. Things we often see in mental health have been melatonin, magnesium, vitamin D. Those are all supplements that we help treat various mental health concerns with. So kind of the take home point for this is to really discuss that with your doctor and let them know what supplements you're taking. Those are equally as important as everything else. And there are some, I don't know the specifics, but some that will interact with mental health medications. So it's really important for your medication provider to know the ins and outs of everything that you take. All right, so we're going to talk a little bit about storage. So this is one of the key points to help mitigate that risk of people accessing medications to overdose on. So across the board here at Linden Oaks, when an adolescent patient comes into our care, uh, pretty much on day one, we tell parents and guardians or whoever's taking care of the child to lock up those medications. Teenagers might give a little pushback on that. Like, I'm becoming an adult. Why are you taking away my independence? But the reality is, like, one of the leading causes of death from suicide is overdose. So we really want to mitigate that risk and lock it. It can be kind of a temporary solution as well while they're in our care. That's our recommendation. But lock it up. And also, like, think about the other folks in the house, including pets and animals. We don't want younger kids or animals getting a hold of these medications as well. We really recommend that parents, guardians, and trusted adults only manage medications with our adolescents. So we want our adolescent patients to know about their medications, what they're used for, how they work, and how they affect their body. Parents, guardians, it is in the state of Illinois, parents and guardians are the ones that consent for medications. So they're the folks responsible for the medications. I put another caveat in here about younger kids in the house. Uh, Reading some of the recommendations from national organizations recommend locking it up in a high place, hard to reach away from ground level. So take away, lock it up, lock up the medications. I do want to just ask if there's any questions about some of the safety considerations that we just talked about before we get into some communication tips about medication safety. That's okay if we don't have questions at this time. We'll have more opportunities as well throughout the presentation. So part of safety, so that's like kind of the nuts and bolts of logistically how do we keep people safe with medications. I think a big part of communication and safety is that they're ultimately, in my mind, one of the intertwined. It's hard to know what's safe unless we talk about it. So I want to provide some background from a nurse's perspective of who works with adolescents and their medications and parents and guardians, and maybe some strategies to us communicate with that treatment team. So here at Linden Oaks, we call the people that interact with our patients the treatment team. So specific to medications, we have medication prescribers, which can be doctors, MDs, DOs, physician assistants, as well as nurse practitioners. We have nurses on our team, although not in outpatient. In inpatient, we have a team of pharmacists, but in outpatient, we do rely on our local pharmacies. Pharmacist is part of that medication treatment team. They're the ones actually dispensing the medications. I think another player as well that we don't maybe often think about is the insurance company. They're the people that often say, hey, this patient is approved for X number of medications. They're part of the treatment team as well. So these are all people that we communicate with about medications. So medication prescriber, nurse, pharmacist, and the insurance company. So specifically, when interacting with that prescriber, um, I came up with some ideas of questions that might be helpful for parents and teenagers to ask about their medications. Might be obvious, but what is this medication used for? It's not so obvious, and here's why. So there are mental health medications that the FDA has said these are for treatment of depression, anxiety, you name it. Then there are some medications that we have found out really help with medication management with our psychiatric patients. And those medications weren't for mental health to begin with. So examples can be some anxiety medications, things for post-traumatic stress disorder. So it's really important to know what this medication is used for, because sometimes medications are used for different things. So the formal term for that is called off-label use. So doctor should inform us, or the medication prescriber should inform us about what that off-label use is for, but also like say that the adolescent goes to the doctor's office for primary care or the emergency room. The nurse or the provider there might ask, hey, what is this medication used for? So that initial conversation with the medication provider, what is the medication used for? Second question that I suggest is, when I take this medication, what can I expect to happen? So this one's a interesting one for mental health medications. I draw an analogy or example of blood pressure medication. So if I take a blood pressure medication, I can take someone's blood pressure and see a drop in the blood pressure. So that treats hypertension, high blood pressure. Mental health medications, with maybe the exception of anti-anxiety medications, it can take anywhere up to 4 to 6 weeks for us to actually see kind of any effect positively in terms of mood or whatever mental health symptom we're treating. So what can I expect to happen is a really good question to know, what should I be looking for in the weeks to come. Similarly, what are common side effects? So typically with mental health medications, we see side effects within the first few days or the first few weeks, and those often go away. It can take some time to adjust to medications. And I always tell patients this too. If you change a dose, sometimes you have those returns of side effects. So that's expected. But what are the common side effects to look out for? Is this something that will go away, or is this something maybe more concerning that I need to tell my doctor about or go to the hospital to get treated if it is an adverse effect of side effects? So, and I'll get to that a little bit here in the presentation. And then kind of that last question, then what are adverse reactions? So there are a difference between side effects and adverse reactions, and I'll address that in a moment. We did have one question here. How often should you see your provider for medication follow-ups? That's a really great question. So it depends. So this is one of those things. The doctor should tell you, or the medication prescriber should tell you how often they want to see you. I know in the hospital, when someone is in an inpatient hospital, the doctor is seeing the patient every day. In outpatient, we see patients up 1 to 2 times a week, sometimes more, depending on what we're doing with medications. Generally, if someone has been here at Linden Oaks, we really want someone to see their medication provider within a week, if not within the first 30 days of being out of our programming. I would say on average, I think people see their medication providers every month, sometimes twice a month, just depending on what medications we're working on. I think once people get on a stable medication regimen, it goes to about 2 to 3 months. So it really just depends, but it's one of those things. Our mental health medication providers really want to see their patients, because that's how we know the medications are working. Is that conversation we have with the patient of like, how do you feel now when you're taking these medications? What symptoms were you experiencing before you came into treatment? What are your goals and your hopes for your treatment? So those are things that we need to see the person either over a video visit or in person. So yeah, great question. How often? All right. So these were questions that we asked of our provider. I think it's important to know what kind of questions to expect that they should be asking parents and the adolescents. So again, safety being the most important thing. Biggest safety thing that we see as nurses is allergies. Got to know what our allergies are. There are people that have allergic reactions to medications, and we don't want to prescribe a medication that would cause them harm. So really important to keep that allergy list up to date. Got to know what other medications that you're taking, because there's interactions. Medications sometimes impact each other, make them less effective, cause side effects, cause adverse reactions. So we need to know that complete list, including supplements, including over the counter. If you think it should be said, it probably should be said. Here's one that's interesting for mental health is, what medications have you taken in the past? I think kind of going back to that analogy about blood pressure medications, we can pretty much say this blood pressure medication is working for a person. Mental health medication is a little bit more subjective. So a medication prescriber will ask what medications you've taken in the past. Have they worked? Have they not worked? They may even ask family members about family members' past mental health medications. Sometimes there's a genetic link that people have that medications work better based on genetics. So they'll be asking you what past medications. They'll specifically ask any adverse reactions. And we'll, like I said, we'll talk a little bit more specifically what those are. I think really important to know is what side effects were not tolerated in the past. Everyone is different with that. So some people can tolerate maybe feeling a little nauseous for a week or two. Some people won't tolerate that at all and say, I need a new medication. So really important to know how people's individual experiences with medications. We should always ask as a healthcare team, are there any financial barriers? There are many different options to pay for medications, and insurance being one of them. Local pharmacies have some options as well. There are some discount generic programs out there as well. So there are alternatives. This is one of the biggest challenge with some of the latest and greatest medications. They're often thousands of dollars if the insurance company hasn't approved them. So providers can be asking thinking about what are alternatives, and us as the consumers too, we can be asking what other alternatives there are as well. And then we should always be asking what's a good pharmacy. I've had it where medications have been sent, although I know we're here in the Chicagoland area out in the western suburbs. If someone's got an old pharmacy on file from living in the city, it can delay the amount of time that we get you the medication. So what is a good pharmacy? So I do know another question was asked, suggestions for motivating your teen when they don't want to take medications. I'll be addressing that when we talk about why people don't take medications. So hold tight on that one. That's a really great question. All right, so those were some questions. All right, I want to decode some lingo. So there's these clinical terms, really fancy terms that are used to talk about medications, and sometimes it's confusing. Yes.
Sorry to interrupt. You were mute. Can you go back? I think you paused for a second. Can you go back
Okay.
to that slide?
Which one?
Just like 3 minutes, or yes, right there. I think you cut out for a second.
Okay. So I'll look at the one here. What, if any, financial barriers there are? That's something really important that we should be asking our patients. Some of these medications that are coming out these days are really expensive. So what are some alternatives if that becomes a barrier? What discount programs are available as well? And we should also know about a good pharmacy. I would hate for a medication to be sent all the way to the city of Chicago when we were living out in the suburbs. And that could just delay us getting our medications to our patients. All right. Are we still with a good connection, Kelly?
All good.
Okay, wonderful. I'm going to move on to a little bit of discussion about lingo, clinical language that we might use that might be needed to be decoded. So one phrase that sometimes we use is let's try this. And what we mean by that is that every patient has a different experience with medication. So it is sometimes a trial and error process. Better said trial and error, but we might hear kind of said, let's try this. Another word that comes up is titrate. Fancy word for we're changing the dose. We're moving the dose up or down and making sure the patient is tolerating that, as well as having the benefit of the medication. So titrate, moving a dose or changing a dose. So speaking of doses, there's some terms, therapeutic dose, therapeutic effect, below therapeutic dose, or kind of a common statement, I don't feel anything yet. Again, it's back to that, it takes up to 4 to 6 weeks for someone to feel the positive changes of a medication with regard to their mental health concerns. So whether it's depression, feeling more energy, feeling more motivation, or anxiety, sometimes feeling that reduction in the stress and the overwhelm, feeling it can take some time. So that's what it all means. Therapeutic dose meaning it's what we want the medication to do. therapeutic effect. It's what the medication would want it to do. And below therapeutic dose, sometimes we need to increase a medication to actually get to that thing that we want it to do. Another term we have here is half-life. That is essentially a fancy term for how fast a medication moves out of the body. So you might hear that. Some medications take a little bit longer to be processed in the body. So doctors are considering doses and uh, the right way to prescribe medications. You might hear a provider say, I'll send in a script. A script, it's not a Shakespeare play. A script is the order, like the actual, this patient is going to be taking this medication, this many pills to the pharmacy. So script is what's communicated to the pharmacy. I put in here a little brief discussion point about controlled substances. Here in Illinois specifically, we have pretty strict laws around how like medications like Adderall are and methylphenidate and other stimulants used for ADHD are dispensed. And a medication prescriber has to actually send something to that one pharmacy. That pharmacy cannot move that from one pharmacy to another. So I know some people kind of run into, oh, this pharmacy's out of stock of this. The medication prescriber would have to send a new prescription to that pharmacy. Kind of on the insurance end, you might hear this term called pharmacy benefit manager. They're the people on the insurance end that make the decisions about what's approved or not from the insurance perspective. Some insurance policies have different tiers of medication. They're like bucket one, these are the medications we prefer that we see patients do best on, followed by other buckets. So sometimes we run into things with the medication prescriber saying, hey, I want this patient to take this medication, but the insurance company is saying, we're not approving it until we try other medications. So some finer points there, but just I think some general knowledge that's important to know kind of what goes on behind the scenes. You might also hear these terms formulary versus non-formulary. Fancy way of saying here's the list of things that the insurance company is going to approve, formulary versus non-formulary, things that might take what's called a prior authorization. So that's the next point here. Prior authorization is a request from the insurance company to the medication prescriber for more information. What medications have they tried in the past? What other kind of treatment is going on? Oftentimes maybe associated with a higher cost of a medication, insurance company kind of doing their due diligence to make sure that the treatment is the most cost effective. So prior authorizations is one thing you might hear. And then as always, medications have a brand name and a generic name. So if you don't know one name, ask that medication provider, ask the nurse, ask the pharmacist, what's the brand name, what's the generic name? Another thing to know about medication safety and communication is who should know about our child's medications. I would say anyone who spends any significant time supervising your child. So school, family, babysitter, or nanny, those folks should know kind of the ins and outs of what medications that someone is taking. And the reason why of that is that if there was an emergency, and let's say someone is taking care of a patient who's starting a new medication, if there was an adverse reaction to that medication, it would be important to know what kind of medication that person is taking. So when the like an emergency room is taking care of that patient, they know exactly what medications they're taking. And also too, like in terms of like emergency situations, if someone needs a surgery, the surgery team needs to know what medications that someone is taking, because that can really impact how they do operations and procedures in those emergency situations. All right, so we're going to get into some finer details about adverse effects and side effects. So adverse effects, think danger, unintended harm, the things we absolutely do not want. So these are some, not all examples. So this is not an exhaustive list, but just some things. So anaphylaxis being one, that's trouble breathing, swelling of the face or mouth, seizures, rashes. There's one specifically called Stevens-Johnson syndrome, which is a body rash that can be really fatal in some cases. Serotonin syndrome, which is characterized by muscle stiffness, increased agitation, aggression specifically, intense mood swings, and one that comes up sometimes in a question that parents ask is, I see that a risk of medication can be increased in suicidal ideations. And for adolescents specifically, that is a risk. It's it's something that the providers really take extreme caution with, and when prescribing medications. And uh, why, and kind of even back to the question, how often should we see the provider? That's one of the things we're asking patients all the time. How are those suicidal thoughts? Are they increasing intensity? And it's sometimes really hard to kind of decipher what, if it's medication or if it's something with the mental health. So I'll address that too in a little bit as well, because I know that's a common concern that parents have. So side effects, conversely, I think dangerous. They can be undesirable and not being able to tolerate. With mental health medications, they often go away. So some examples of these can be headaches, GI symptoms like nausea, upset stomach, decrease in appetite or an increase in appetite, fatigue, tiredness, and for some people, sexual dysfunction. Uh, One thing to really think about when talking about adverse and side effects from a parent's perspective, and I often coach parents with this, um, rather than knowing the specifics, ins and outs, one approach too is to know, is this a change for my child? As the parent or guardian, you know your child the best. So that kind of trust that gut intuition. Is this a change? And kind of ask, like, what could it be, medications? Could it be something going on? Um, and so we may not always have the words to describe what we observe. So always speak up. And if concerned, if really concerned and you're seeing something that you've never seen before and really concerned, we can call the doctor, call that care team, and we can consider going to the emergency room or calling 911. So some finer tips about medication safety there. One of my favorite tools for patients is medication lists. So here at Edwards Elmhurst Health, we actually have a medication list template. Includes any kind of medication someone takes, emergency contacts, the doctors that this patient sees, and allergies. So any pill, supplement, over the counter can be put on this list. I recommend parents keep a copy of a list in your child's backpack or purse or wallet. Um, Especially like going to summer camp, these medication lists can be really helpful. There's apps on phones that can help keep track of medications, as well as my chart. That's something we use here at Linden Oaks. That can have a medication list in there. But nothing better than a good old standby paper copy. All right, so medication safety. Got to talk about Dr. Google and Dr. TikTok. Um, and this is kind of a professional's take on these sources. And the little comic here says, I'd recommend real doctors that stay away from getting a second opinion from Dr. Google. Here's why. There's a lot of great trusted resources out there. Websites with .edu, .gov, or even local hospital websites can be really great resources. I say this, I don't think everything on the internet is bad. And here's why. I think it can be useful for getting raw data. But what the problem I think ends up happening is that it doesn't give us unique information to the patient. So I think that's where people can run into concerns about thinking that everything that's on this medication website talking about all these side effects is going to happen to me. And that is often not the case. So it doesn't give us that unique data to you. But I do think too, it gives us a good way to ask questions and maybe helps us consider critically how to think about our medications. So best practice, those trusted resources, .edu, .gov, or local hospital websites. All right, so that was safety. Do we have any lingering questions about medication safety? And if questions pop up too, feel free to put them in towards the end as well. So this kind of going back to this question that was asked from the audience, any suggestions for motivating your teen when they don't want to take them? So we're going to unpack that. Let's start with why people don't want to take them. And even before we get to why we don't take them, let's talk about what medication taking is about. So that's this fancy term called adherence. So adherence Uh, and this is something I came up with here as a kind of a way to understand it, is that it's a mutual understanding, kind of an agreement between a patient and that care team that considers what the patient values and what's really important to them and what they wish for their care, as well as the healthcare provider's expert recommendations from their years of learning and studying about medications and mental health. And those are both aligned, and we're going towards a common goal. So I think these are really important things, that patient has their value, has their say, the doctor and the medication provider has their recommendation, and those are both aligned and going in the same direction. Simply put, a common understanding, something that we can all understand on that treatment team. So really the patient is part of that treatment team, equal decision maker in these process. The World Health Organization puts it this way: it's the degree to which a person's behavior, so something that we do, corresponds with the agreed recommendation from a healthcare provider. So what do we actually do with medications? And I might have some statistics here. Yeah. So further defined, what this means is it's taking medications always on time, never late, the right amount, in exactly the same way. That's a full-time job. That is a lot of things to consider. So not surprisingly, I saw statistics anywhere from 10 to 90% of people actually adhere to their medication. So as low as 10% up to 90%. I think kind of the average is about 50% of patients actually follow never late, on time, right amount as directed. So here's just a few things that might get in the way of someone taking their medication. There's patient factors. So let's unpack that with the teenager. The teenager may not like to take their medication. I would wonder, what might be the one of the biggest reasons someone might not want to take their medication. And I think the biggest thing I hear from teenagers is, it makes me not feel good. So that's really kind of asking your teenager, how do you feel about that medication? And then working with your teenager and the medication provider to advocate and say, hey, this medication is not making me feel great. Um, I know that comes up with a lot of stimulant medications for ADHD. It can really just make some people feel not so great. So, and everyone's different. So these aren't 100% of patients that take a stimulant experience these things. So I think it's really important to ask really great questions about, from your teenager's perspective, of like, what might be getting in the way of me taking these medications. It's often side effects. Sometimes it's remembering. Um, so I'll go over some strategies that help with remembering. I think also important to know is that there's some things on our end as medical providers that get in the way of people taking their medications. So sometimes we're unaware of all the medications that someone takes. So that can really impact how we prescribe medications. And sometimes the treatment is too complex. Sometimes people come in with medication lists, 10, 15, 20 different medications. How could I ever remember to take 10, 15, 20 medications? So is it a conversation about simplifying it? So I just really want this to be a big take home point. Medication is a huge commitment. It is a time commitment. It sometimes is a full-time job remembering to take these things. So for those that take medication, I just really want to validate that this is a big deal. So we might forget to take medications from time to time. And uh, sometimes that is okay. So it is a big commitment. So I think, especially for these teenagers, that knowledge is power. Having them have a decision in making the right informed decision for themselves about what medications to take. Ultimately, the parent has to sign off on the medication, but um, the teenager adolescent patient should be an equal stakeholder in that. I think it's also really important to know, kind of knowledge wise, again, what this medication is used for. Is it off label? Is it a medication that was used for another health condition and we can use it for mental health? And again, reminder of asking what this medication is for and why it's being prescribed. And always remember too that it does take some time. So sometimes we have to ride out some of the side effects. Sometimes we have to ride out some of those things that happen within 4 to 6 weeks before we see mental health medications kick in. All right, so the why not? Why don't people take their medication? So thinking about side effects, I feel X, Y, and Z. So we can fill in that statement with anything that someone feels. So really important to be constantly asking and, or consistently, I should say, consistently asking how people are feeling with their medications. I would say why people don't take medications. Was the plan fully explained? Did the patient and family have all their questions answered about the medication? I don't know if I would want to take a medication if I didn't know fully what I was to expect with it. Kind of similarly too, was that treatment plan mutual? Did we all come to that agreement with the medication provider and everyone else involved? And did you have a say in the plan? I think for teenagers who are learning about independence and becoming adults, did they have a say? That's something that can really just kind of shift that perspective for the teenager of like, oh, this is my treatment, and taking that ownership of it. I think motivation as well can be associated with timing. So, is there a better time of day to take this medication? So, some doctors start off saying, hey, take them in the morning. Well, what if the teenager doesn't wake up to 9 or 10 o'clock in the morning and is really slow to wake up? You can always ask the doctor, can we take it in the evening? Can we take it at nighttime? Um, there's flexibility with those medications, but talk with the medication prescriber first before making those changes. And then I think a reminder too to tie this with routine. I know I was talking with one of our providers here at Linden Oaks. He'll often recommend to the teenagers put like a post-it note or something on your toothbrush or something you do every day to remind you of your medication. So that can be really helpful. As always, there's technology, uh, cell phones, got timers on them. Those can be little great reminders to prompt us to take medications. So those can be um, some strategies to help us take our medications. And we're getting close to the end, so I do want to talk about a few more other things here, specifically concerns and fears. So I did get to talk with some of our medication prescribers here at Linden Oaks in preparation for this presentation and asked what are common questions that parents have about medications. So the first one here is, will my child or become dependent on it, or is it addictive? And I think there are some anxiety medications that can become addictive. Uh, and the caveat here is if someone is taking the medication as prescribed under the guidance of that medication prescriber, that's really where it doesn't become addictive. If someone starts taking it in a way that isn't prescribed, that's where I think some people can run into uh, addiction concerns. I would say, with the exception of a few medications, most mental health medications are not habit forming. They're not dependent. And then similarly to this, it's like, would someone have to take this for life? Not necessarily. I think some people take medications for the duration of their mental health concern. Some people have more chronic mental health concerns that do last throughout their life. So it is not always a for life consideration with medications. And in fact, there are what we have seen just in trends in prescribing um, is that sometimes people have too many medications. So there are prescribers that really work with patients to get to the fewest amount of medications as possible. So that there's a balancing act as well that happens in. Uh, so we don't just want to medicate people. We want the medication to be really targeted and appropriate for the mental health concern and for that patient. A big concern people have is about weight gain. Yes, that is a side effect of medication, and no, not everyone gets that side effect. It is something that we do take people's weights. We are monitoring laboratory values like blood tests to make sure that that side effect, if it's happening, that we either treat that or recommend changes with medication. So it's something we are monitoring, but not everyone gets that as a side effect. And then I think too, kind of back to that one concern about suicidal ideations being uh, an adverse reaction to medications. So there are medications that have this thing called the black box warning. It's essentially the Food and Drug Administration has seen evidence that could be associated with increased suicidal thoughts. I'm not sure on the specific statistics, but it oftentimes with these adverse reactions, it is small percentages. So it is by far not uh, the majority of people's experiences with it. It is something to consider. So I think as a parent, the things to consider? Are you seeing maybe we saw one mood in one way that the child was, and then a couple days later, completely drastic different mood change. So that's something that could cue us in as someone not tolerating medications. And then some takeaway points with this as well, with concerns and fears, things to consider. Uh, the medication prescriber should be having a risk and benefits conversation with you. They should be informing you of all the risks that this medication has, as well as the therapeutic effects. And it's kind of up to the parent and the patient to decide whether or not that medication is for them. This is your child's treatment. Only you and your child can make that informed decision with that consultation of the provider. And I would say the providers do have the best interest of our patients at mind, and they really do feel that medications are a key component of treatment, and have expert recommendations of it. Our providers have been doing this for many years. I wouldn't even know where to begin with the combined years of experience of our medication providers here at Linden Oaks, but um, they're experts in their fields. And then I think the other thing too is, if people do have concern about medications and decide not to go down that route for their treatment, the really important take home point on that is that that patient and the family will really need to rely on other parts of therapy. So whether that's individual therapy, family therapy, kind of looking at the family system, using those coping skills, those pieces, like really kind of making us a support system around. So that, as well as with medication, these are things as well that are really beneficial to helping people improve their mental health. All right. So I hope I answered that question about motivating your teen when they don't want to take them. I think it's really just having an open and honest conversation with your teenager. How are they feeling? Do they like it? Do they not like it? Kind of giving them permission to say, yeah, I don't like this. It doesn't make me feel great. Um, and the key component of that too, knowledge. Knowledge is power. Knowing what this medication is going to do, and can we kind of wait to see if it's going to work as well. All right, we are almost done with our time. So just a few resources I want to leave you with. Don't forget about your local pharmacist. They have 5+ years of education experience. They are truly the experts on medications. Every medication, they have to know them. They have years of professional experience and they know those ins and outs. So they're a wonderful resource about medications. Uh, if someone needs to dispose of medication, especially like if there's concern, if someone was having like suicidal thoughts about using their medications, there's a lot of great resources to dispose of those medications. So local police departments, fire departments, some pharmacies, some emergency rooms. Uh, there are medication disposal packages that I think people can buy, consumers can buy. It's like essentially open a pouch, add some water, shake, and throw it in the landfill. So that can make that medication not work and dispose of properly. Big point here is never flush a medication down the toilet. It's actually a big problem with our water supply that there's pharmaceuticals in the water supply. So please dispose of them properly. And then, as always, if we're in crisis, what do we do? Some great resources. 911. We have this wonderful resource, National Suicide Prevention Lifeline 988. Linden Oaks has a 24/7 assessment and referral center. And we have poison control as well. One moment, please. So that's all I brought for you tonight. I do want to open it up. Is there any questions that people have?
Thank you so much, Sam. That was really, really insightful. Again, we're going to open up the question and answer session right now. So if you have some, feel free to chat me.
Kelly, I think we lost you.
Sorry, sorry about that. Thank you so much for that presentation. Feel free to chat any questions that.
Kelly, I'm not sure if it's still muting.
It is muting. It is. If you have questions after the call, feel free to email Linden Oaks Marketing at eehealth.org. Otherwise, please send them through a chat right now. And thank you so much, Sam. This was very, very helpful and informative. I really appreciate it. it.
You're welcome. My pleasure. I was glad I could talk about such an important topic tonight with you all. I do see a question that came in the chat. Um, do we recommend that parent shares with the school social worker or nurse that my child's on mental health medications if I medicate my child routinely outside of school hours? I would say for sure if they're getting a medication in school hours, that would be a great recommendation. I think it's really kind of up to the parent and specifically the child. Are they comfortable with these people knowing that information? I wouldn't say it would hurt, but it's ultimately the child's decision if they want to share that information with the social worker or the school nurse. That's how I would answer that question. Oh, can you skip doses? I mean, we don't recommend it. I think that's the reality of it. Um, this is not a statement to be taken with every medication. So I think, and why I say that is some medications need to be at specific times of day. And there are some medications that we're working on making sure that there's a therapeutic dose in the bloodstream. So um, I know old medication is lithium, and that's actually a really great mental health medication that I've heard prescribers talk about a lot. That one and others like that, we really want to make sure we don't skip doses. And if we do, to kind of rely on the medical treatment team to make a recommendation of when to take the next dose. In general, what I hear doctors say is like, wait to take it to the next dose. I would say across the board, never double up on a dose. That's just generally something doctors and prescribers don't say. So ultimately, from a nursing point of view, it's always asked that question: when do I take the next dose if I miss a dose? And most mental health medications, unless they're for as needed purposes, need to be consistently taken. And part of that, kind of going back to that 4 to 6 weeks point, is we really need to make that medication build up in the bloodstream so it can get to the brain, get to the parts of the body that ultimately have the relief from the mental health symptom. So really important to consistently take these mental health medications. And if you're not, I would say be honest about it. I'd rather, as a nurse, know if you're not taking a medication, um, if uh, if you don't like it. What's the use of taking medication if it's not working for you? All right, so I got a question here from the audience here. Let me just try to get at the question. So, as I understand it, so some medication dose changes just happened, and we had some medication dose increases, maybe some new medications. How do I tell the psychiatrist that my child isn't doing well? Um, well, suffering from depression, anxiety currently when my son told the psychiatrist, I'm good. Oh, that's a, yeah. So teenagers like to save face sometimes, I think. So they might just tell the person, I'm good. Um, I think so. Mental health is a little tricky because there are some laws that protect adolescents in their right to treatment. Uh, I think if there is like a release of information form signed from the parent to the psychiatric provider, I think it's totally within the right of the parent to kind of go to that medication provider and say, hey, this is what I'm observing. I would say stick with what we're observing because those are like, what is my child doing? Are they sleeping more? Are they eating less? Isolating, withdrawing? Those are really important pieces of data for the mental health provider to know. So what's that behavior? What are we seeing? Hope that helps with that question.
All right. Thank you, Sam. I think those are all the questions we have today. So that concludes the presentation, and we will open up the poll. It's a short 5 minutes. Please complete that and then hit submit. And I thank you again for your time tonight, everyone. Have a good evening.